Hi, everyone, and welcome to another edition of the Accreditation Station. I'm your host, Rocco Romeo, and today we are joined by Scott Majewski from ImageFirst. Welcome, Scott, to the Accreditation Station.
Thank you, Rocco. I appreciate it.
We're going to have a discussion today just about HLAC, and I guess my first thing I wanted to ask you about is, how has being HLAC accredited benefited ImageFirst?
Well, at ImageFirst, one of our primary goals is helping our clients with patient satisfaction. And the accreditation process helps our teams understand how linens need to be handled in the healthcare setting. It essentially helps make our laundry a healthcare facility.
And why is that so important, that accreditation component of HLAC?
Well, that component tells both our associates and our clients that we're committed to the same standards that the healthcare system, hospital, outpatient setting, really anywhere it is, that they're beholden to, that we can do the same thing.
I'm sure, like any other laundry, once you go through this process, it's quite a bit of work to go through the HLAC process. But from your perspective, what are some of the changes and some of the benefits you saw pre-accreditation versus post-accreditation to some of the ImageFirst laundries?
Sure. I think the process touches a lot of aspects in the facility. It's really focusing on the hygienically clean linen, but it also ends up helping with more robust programs in housekeeping, hand hygiene, just really safe linen handling throughout the facilities. And then those best practices can be shared easily across our facilities in working with accreditation inspectors.
So now, when you were going through the HLAC accreditation process, what was that like to you in terms of, did you see immediate changes, immediate improvements, like just within the actual organization itself?
So at ImageFirst, we have some different monthly, quarterly, and annual internal processes to be ready for client visits at any time. But the accreditation process really amps up continuous improvement. So it takes okay processes and brings them to good with feedback, and good processes to great. And then as you get reaccredited, you were good last time, or you were great last time, but you just get that much better. And there's always nuances to the previous time, new best practices that you learn and implement. So it really just strengthens you each time.
I agree with you on the having your people ready at all times for any type of tour that happens, because that process provides consistency, right, and control that everybody knows about. So it's less like somebody's coming. It's like, we're ready. You know, I think you would agree that that's probably one of the key benefits after going through a few of these.
Yeah, absolutely.
Yeah.
Yeah, there's no previously to being with a healthcare laundry, in other non-healthcare laundries, if a client was going to come through and visit, it was that night before, everybody's doing a bunch of cleaning to try to get ready for client.
Right.
And that's not great. In the healthcare world with HLAC accreditation, you're just not doing that. And it's actually a better feel for all of the associates that work at the facility, that there's not a drop everything and do this.
I think just that training component. Yeah, I think that training component alone knows that your staff knows what they're doing, and they're going to, at all times, whether there's a tour or not. And I think that's probably one of the biggest advantages. I think you would agree with that, is that training component that's required makes sure that we're always plant ready, because our employees are doing what they're supposed to be doing.
Yeah, absolutely.
Yeah. So we've talked about, some of the benefits that the HLAC accreditation has had within the organization itself. So let's move over to your hospital partners. How have they reacted, and how have they benefited from you being ImageFirst being HLAC accredited?
So our clients, the healthcare partners, they know that our accreditation is a validation of everything that they're inspecting. So most of our clients do annual inspections with their own infection prevention team, and they've got a checklist, and typically it's a one-page checklist to make sure that we're doing the right thing. and then they see the HLAC accreditation, and we share the depth of the things that we do through the accreditation process, and they end up taking away best practices back into their systems, because we can point to processes that we do that they may want to adopt within some of their linen handling at a hospital. So it makes us the experts by being accredited to in turn help them.
And because you've gone through quite a few of these, if you were speaking to someone who's going through accreditation for the first time, what would you tell them about the process and what to expect and what they benefit from?
I think from if you're just completely new to the process, I think certainly the first thing would be to understand some of the basic needs, soil separation and airflow, and a lot of the training for employees that at first I don't think people realize, how much is necessary just on the setup of the facility and how much is involved with training associates. Once that groundwork is set, it's worthwhile work because of those continuous improvements and steady processes that are created by going through the accreditation. So definitely worthwhile work.
So you've heard, Scott, I'm sure, about the new 2023 standards that are coming out and are generating a lot of interest. And one of the key areas where changes are going to be made with the standards are going to be more focused on hygienically clean linen matters and less on items such as the eye wash stations. How do you feel about the upcoming changes to the 2023 standards and how it's going to affect ImageFirst?
When I first read that, I was excited. I think it'll allow laundries to focus on what's most important in the accreditation process, and that's the safe linen for patients and caregivers. At ImageFirst, we already have strong programs for safety and maintenance. So when we talk about things like eye wash station, there are separate inspections and maintenance programs for those things. So when we're talking about really focusing on the linen, on safe care and process for linen handling, I think it's really focused in the right place. So it's an exciting move.
Yeah, it is exciting. It's going to be a bit of a game changer. So Scott, probably anything else you maybe want to tell somebody out there who's considering HLAC accreditation? What else, any other things you may want to tell some company that's undergoing or thinking about undergoing HLAC accreditation?
I think what I've heard is some people see it as it could be intimidating because it's a process and it takes some work. But I would say more so the inspectors that we've had and the process is really a partnership where they're looking for, okay, I see what your practice is. Here's a couple things you could do to improve that. So it's really approached from my perspective. It's always been a partnership in recommending good best practice, not as a we're going to find out what you're doing wrong and make you fix something. So I would say for anybody considering going through it or in the process of going through it, if you see your team from the accreditation group as almost another employee that's just supporting improvement, it's really the best way to look at it because that's what they're there to do, and it's really beneficial when you take it through that lens.
I think you're right. I don't think any laundry can actually go through the HLAC accreditation process without coming out of it a better, stronger laundry. And I think employees are proud to work for these laundries that are accredited. So I want to thank you very much, Scott Majewski from ImageFirst, for the time you spent with us today and for your insightful comments into the accreditation program. So thanks again, Scott, for joining us.
I appreciate the time. Thanks for having me.